It's becoming increasingly common among women in their childbearing years, endometriosis. Well, joining us with more information on treatment and a personal journey to conception is Dr. Jessica Mclaughlin, Reproductive Endocrinologist at Coastal Fertility Specialists, and patient Alexis Evans. It's good to have you both with us today.
Oh, thanks so much for having us.
So, Alexis, we want to hear all about your journey. And before we do that, though, maybe you can explain for us, Dr. Mclaughlin, what endometriosis is.
Yeah, endometriosis affects about 10% of all reproductive age women, but associated with an increased risk of infertility. So about 40% risk of infertility associated with endometriosis. And it is the normal tissue that actually grows on the inside of the uterus, actually forms outside the uterus, and that just causes this inflammatory reaction that can cause scar tissue, anatomic distortion, and can really affect fertility.
Now, you say 10% of women of a particular age. Is it more common the older the patient gets?
No, really anybody in the premenopausal kind of age range, about 10% risk for having it.
Okay. And for you, Alexis, when did you find out that you had endometriosis?
I was in my late 20s. I was about 28-ish, maybe.
Yeah.
It was about 2020 when I was officially diagnosed.
And you knew that you always wanted to have children.
Yes.
So when you were met with that diagnosis, what went through your mind, and then what was the next plan of action?
My husband and I have been trying to get pregnant, and it just wasn't working. We'd seen my regular OBGYN, and then we saw a couple cysts, and she was a little concerned, but then COVID happened, and everything sort of just delayed. And by the time we got in and she got to see the cysts again, see what was going on, she was like, "I'm pretty sure you have endometriosis," and I had never heard of it. So we immediately started Googling in the doctor's office, and everything on there just made sense. All the symptoms were things that I had experienced: irregular periods, long periods, heavy periods, discomfort and pain, the whole 9 yards, the endo belly where you look pregnant when you're not. Severely bloated, all the fun things. And within a week of that, I was having the laparoscopic surgery to confirm it. And
laparoscopic. So tell us a little bit more about this. Is that the only way to detect 100% that you have endometriosis?
Right, so you can clinically suspect it based on kind of some of the symptoms, especially, you know, Alexis was having a lot of those symptoms, painful periods and infertility, but certainly the definitive diagnosis is kind of only made with a pathologic specimen after a surgery.
So that's a little invasive. Were you scared?
I don't know that I was scared, more stressed, anxious. It didn't help that the day of my surgery there was a tropical storm coming through.
Of course. Like they say, when it rains it pours, right?
All the COVID protocols, so like my husband couldn't be there with me. I had an allergic reaction to one of the medicines they gave me for pain. So it was just a complicated day.
But you had it, and then it was certain you actually had endometriosis. So then what treatment followed up on that to allow you to then conceive? Because there is a happy story at the end of all of this. We'll get to that in a moment.
During that surgery, my OBGYN found that my tubes looked pretty well blocked. She got as much of the endometriosis that she could, but she said, "You're going to need to probably see reproductive endocrinologist," and she recommended IVF. Luckily, we got in with no problem, and I got paired with Dr. Mclaughlin within about a month, and we spent about 4 months at that point just doing tests, all the different treatments, and then Dr. Mclaughlin decided the best course of action was to remove my tubes altogether because they were completely blocked.
Oh, wow. Oh, goodness. So then how did you conceive, and how did this come about?
So about 2 months after we had my tubes removed, we did an egg retrieval, and we ended up with 10 embryos we were able to freeze. And a month later, we transferred my now son, and he stuck around.
Congratulations on that.
Thank you.
And Ben is now 1 year old, just about one month. So congratulations on that.
Thank you.
So really, this is quite the ride. This is a journey, a very complicated journey. Are cases typically this complicated?
Yeah, endometriosis can really have varying symptoms and different ways it can cause infertility. So sometimes it's so severe, like Alexis's case is causing this great kind of anatomic distortion. The tubes were blocked, something called the hydrosalpinx, which really necessitates us to go take them out. But some of the times we're having mild endometriosis that's just kind of causing a negative inflammatory environment in the abdomen, which just eggs and embryos don't like.
So besides surgery, though, is there other treatment? Is there medication that can help with that?
No, not when we're trying to get pregnant. So certainly there are for women, you know, who are not with the goal of kind of trying to achieve pregnancy. But actually, most women really don't necessarily need a surgery from a fertility standpoint. A lot of times we can do fertility treatment just around the endometriosis. Certainly. But because Alexis had such a significant, you know, case, we did need to do a surgery. And then really, what IVF does is it allows us both to bypass fallopian tubes and the endometriosis.
That's wonderful. Well, congratulations again.
You.
And thank you so much for sharing your story with
course,
us and for our audience who I know are going to find inspiration and hope in their quest to start a family as well. And thank you again, Dr. Mclaughlin, for joining us on that. So endometriosis awareness, it's happening at the end of the month. So anybody who has any more questions, you can always contact Coastal Fertility Specialists. We're back in 2 minutes.